Cancer is, well, a disease that starts in our cells. You see, cells are the tiny building blocks of our bodies. Normally, cells grow and divide to make new cells as our bodies need them. When cells grow old or get damaged, they die, and new cells take their place. But cancer starts when cells in a part of the body start to grow out of control. Instead of dying, these cells continue to grow and make new cells that the body doesn't need. These extra cells can form a mass of tissue called a tumor. Tumors can be either cancerous or benign. A cancerous tumor is malignant, meaning it can spread to nearby tissues. Benign tumors are not cancerous and do not spread. Cancer can start almost anywhere in the human body. It's a complex disease with many different causes, symptoms, and treatment options. Understanding the basics of cancer can help you make informed decisions about your health. Cancer is not a single disease, but rather a group of more than 100 different diseases. Each type of cancer is named for the part of the body where it originates. For example, lung cancer starts in the lungs, and breast cancer starts in the breast. Cancers are broadly classified into categories based on the type of cells they originate from. Carcinomas are the most common type of cancer, originating from epithelial cells that line the surfaces of organs and cavities. This category includes cancers of the lung, breast, prostate, and colon. Sarcomas arise from connective tissues like bones, muscles, cartilage, and blood vessels. Leukemias and lymphomas are cancers of the blood and lymphatic system, respectively. These cancers affect the production and function of blood cells, impacting the body's immune response. Each type of cancer has its own unique characteristics, growth patterns, and treatment approaches. Understanding the different types of cancer is crucial for accurate diagnosis, prognosis, and personalized treatment plans. The exact causes of cancer are still being researched, but we know that a combination of genetic and environmental factors plays a role. Genetic factors refer to inherited genes that can increase a person's susceptibility to developing cancer. These genes can be passed down from parents to their children. Environmental factors include exposure to carcinogens, which are substances that can damage DNA and lead to cancer. Common carcinogens include tobacco smoke, ultraviolet radiation from the sun, and certain chemicals. Lifestyle factors also contribute to cancer risk. Smoking is a major risk factor for several types of cancer, including lung, throat, and bladder cancer. A diet low in fruits and vegetables and high in processed foods can increase the risk of certain cancers. Physical inactivity and obesity are also linked to an increased risk of cancer. Cancer can manifest in various ways, and the symptoms often depend on the type and location of the cancer. However, there are some common warning signs to watch out for. Unexplained weight loss, persistent fatigue, and pain that doesn't go away or worsens over time can be indicative of cancer. Changes in bowel or bladder habits, such as persistent diarrhea, constipation, or blood in the stool or urine, should not be ignored. Skin changes, including a new mole or a change in the size, shape, or color of an existing mole, can be a sign of skin cancer. Persistent cough, hoarseness, or difficulty swallowing may indicate lung, throat, or esophageal cancer. Unusual bleeding or discharge from any part of the body, such as the nipples, vagina, or rectum, should be promptly evaluated by a doctor. Section 5. Staging cancer. Understanding the progression. When cancer is diagnosed, doctors determine its stage to understand the extent of the disease. Staging helps determine the prognosis and guide treatment decisions. The stage of cancer is based on the size and location of the tumor, whether it has spread to nearby lymph nodes, and whether it has metastasized to distant organs. Stage 0 cancer is considered precancerous, where abnormal cells are present but have not yet invaded nearby tissues. Stage 1 cancers are typically small and localized. Stage 2 and 3 cancers indicate larger tumors that may have spread to nearby lymph nodes. Stage 4 cancer, also known as metastatic cancer, means that the cancer has spread to distant organs. The higher the stage, the more advanced the cancer is, and the more challenging it can be to treat. Section 6. Diagnosis. Unveiling the truth about cancer. Diagnosing cancer involves a combination of medical history review, physical examination, and diagnostic tests. Doctors will ask about your symptoms, family history of cancer, and lifestyle habits. They will perform a physical exam to look for any abnormalities. Imaging tests, such as X-rays, Connecticut scans, MRI scans, and PET scans help visualize internal organs and detect tumors. Biopsies involve taking a small sample of tissue from the suspicious area and examining it under a microscope to check for cancer cells. Blood tests can detect tumor markers, which are substances released by cancer cells into the bloodstream. Other blood tests can assess organ function and overall health. Genetic testing may be done to identify gene mutations that increase cancer risk. Section 7. Treatment options. A multifaceted approach. Cancer treatment depends on various factors, including the type, stage, and location of the cancer, as well as the patient's overall health and preferences. The most common cancer treatments include surgery, chemotherapy, radiation therapy, immunotherapy, and targeted therapy. Surgery involves removing the cancerous tumor and some surrounding tissue. Chemotherapy uses drugs to kill cancer cells or stop them from dividing. Radiation therapy uses high-energy rays to damage and destroy cancer cells. Immunotherapy helps boost the body's immune system to fight cancer cells. Targeted therapy uses drugs that specifically target cancer cells while sparing healthy cells. Treatment plans are often individualized, and a combination of therapies may be used. Section 8. Prevention and early detection. Your best defense against cancer. While not all cancers are preventable, adopting a healthy lifestyle and getting regular screenings can significantly reduce your risk of developing cancer. Quitting smoking is one of the most important things you can do to prevent cancer. Maintaining a healthy weight through regular exercise and a balanced diet rich in fruits, vegetables, and whole grains is crucial. Limiting alcohol consumption and protecting your skin from excessive sun exposure can also reduce cancer risk. Early detection is key to improving cancer outcomes. Regular cancer screenings, such as mammograms for breast cancer, colonoscopies for colorectal cancer, and Pap tests for cervical cancer, can detect cancer at an early stage when it is most treatable. Section 9. Importance of regular checkups and screenings. Regular checkups with your doctor are essential for maintaining good health and detecting potential health problems early on. During a checkup, your doctor will review your medical history, perform a physical exam, and order any necessary tests. Screenings are tests that look for diseases before symptoms appear. They help detect cancer at an early stage when it is most treatable. The recommended screening tests and frequency vary depending on your age, gender, family history, and other risk factors. Talk to your doctor about your individual risk factors and the recommended screening guidelines for you. Don't delay or ignore any unusual symptoms. Early detection and prompt treatment can significantly improve cancer outcomes. Section 10. Seeking information and support, resources, and organizations. Navigating a cancer diagnosis can be overwhelming. It's important to seek information and support from reliable sources. The American Cancer Society, the National Cancer Institute, and the cancer support community are excellent resources for information, support groups, and financial assistance. Don't hesitate to ask your doctor for recommendations for reputable cancer centers and support services in your area. Talking to other cancer survivors or joining support groups can provide emotional support and practical advice. Remember that you are not alone in this journey. Many resources and organizations are dedicated to helping cancer patients and their families cope with the disease and access the best possible care. Section 11. A message of hope, empowering yourself in the face of cancer. A cancer diagnosis can be life-changing, but it's important to remember that there is always hope. Advances in cancer research and treatment have led to significant improvements in survival rates and quality of life for many cancer patients. By educating yourself about cancer, adopting a healthy lifestyle, getting regular screenings, and seeking timely medical attention, you can empower yourself to take control of your health. Remember that early detection is crucial, and prompt treatment can make a significant difference. Maintain a positive attitude, surround yourself with a strong support system, and never give up hope. Cancer is a challenging journey, but with knowledge, support, and a fighting spirit, you can navigate the path ahead with strength and resilience.